So I guess the first question would be is how was Justin Brosky promoted to the position of paramedic here at Hillsborough County Fire Rescue when he didn't have state certification?
So he was an employee of ours. We knew that he had been in paramedic school and had successfully completed paramedic school. He filled out an application, and on the application it indicated that you're state certified paramedic. He misrepresented the facts, and I think a basic principle that we follow in the department here is that we expect our employees to be honest. We expect them to be truthful. He misrepresented the facts. And so he was entered into the class, and he began the orientation. He completed the orientation. He was successful in the orientation. He began to practice as a paramedic. During a routine audit of credentials, one of our training officers caught that there was no number for his paramedic certification and began to look into it, and that's when we discovered that he did not have on record the paramedic certificate. He was immediately removed from duty. We contacted him, and he said, I have it at home, I'll bring it in. He was unable to produce it. We placed him on administrative leave, notified the union of what we had found, and then we notified the state of Florida. They investigated it. He then resigned from the department rather than have any other activity against him. He resigned from the department, and he surrendered his certificate to the state. So important to note that we caught that. We found that he had indeed misrepresented the truth. He did not have a certificate and was able to get through the course. Through the audit, again, we found that he did not have the certificate, and we removed him from duty. One of the things that we did after we found that, we implemented a practice so that we would absolutely verify the credentials before an employee began the program, before they received the promotion. That was put into place. We went back and checked all the records that we could find. We didn't find any time where that had happened previously, and we do have that in place to prevent it from happening again in the future. Interesting to note, the county audit department was auditing training, and they looked at our practices that we had put in place. They were completely satisfied with them. And probably more significant is that the state, fully aware of all the conditions, the state had no further sanctions against the department.
Thank you for bringing that up. I was curious as to whether or not the state did hold the county responsible in any way, shape, or form, fines, discipline, anything like that?
No, sir.
Nothing? Okay. Is it illegal for someone to be working as a paramedic without state certification?
Legality, I don't know that. I will say that it would be very much like a paramedic student who is riding with a paramedic. In every case that he attended patients, there were 179 of them, he was always being supervised by a rescue officer. He was a trained paramedic through the educational program. He was not state certified. So he was always supervised by a rescue officer, and we also QA'd every single call. We had a quality assurance officer look at every single call, found that there was no discrepancy in any of the treatment, any of the reporting, and some 179, I think, patients that he had interacted with in the short period that he was on the street.
Okay. Did any of the treatments include any invasive procedures like IVs or anything like that?
I would suspect they are, but I haven't looked at every one individually. The quality assurance officer could provide that. We could provide that.
Okay. What sort of liability does that open the county to? Any idea?
I don't know what the liability, I guess if we didn't take action, it was an honest mistake, I believe. If we didn't take action, if we didn't put in protective measures, if we didn't do the quality insurance, if we didn't report it to the state, there could be some liability, but I think we did everything that we could immediately upon being aware of it.
Okay. Now, you checked, did any of those patients develop any problems as a result of the procedures that he performed on them?
Nothing was noted.
Okay. And who checked?
Our quality assurance officers.
And
that's their job.
Okay.
We have quality assurance officers that review reports, and that's their job.
And these are employees of Hillsborough County Fire Rescue? Or
Yes, sir.
Okay.
Yes, sir.
Okay. So, all right, and you said 179. Now, have you reached out to any of these patients for any reason to let them know that they were worked on by somebody who wasn't certified?
No, sir, not to my knowledge.
Is that something that
They received good care from the rescue officer. He just was on scene. We have many people on scene. So we verified that the treatment was appropriate, that everything was done up to standards, and that was the case.
Okay.
So what would be the reason? So I don't think we saw a need to reach out to the patients because there was no detrimental effect.
As far as you know, okay. I don't know how.
Per the quality assurance.
Okay, fair enough. I don't know how your billing works, if there is billing for taking people to the hospital or performing certain types of procedures on them, or any of the patients that he treated out in the field, any of them billed for procedures he may have performed?
Anyone who is transported receives a bill.
Okay. And what about other things like oxygen or IVs or anything like that?
I think you were provided with the record of how we charge.
Okay.
So those standard procedures those standard charges would be implemented.
All right. So if he provided oxygen and noted it on some form or report, then that person would have been billed.
They're billed based on the transport by the crew. So there was always a rescue officer in charge of the scene. He was never in charge of the scene. He was just part of the crew.
Okay. Well, he was, as I looked through his records, I noticed that he was given a raise when he was promoted from firefighter to paramedic. Has any of that money that he was provided with that raise been returned to the county? Is that something you required or asked for?
That was not part of our calculus, no, sir.
Why?
He resigned.
Yeah, but he got the money inappropriately, right? The raise.
He resigned from the department, and that's where it stopped. He gave up his certificate. He resigned from the department.
Okay. Whose responsibility is it to make sure that someone being promoted to the position of paramedic, in fact, is state certified?
That is part of the calculation that's done by the training office that verifies credentials.
Okay, and was that, is that the way it is now, or was that the way it was then?
That's the way it was then, and that's the way it is now.
Okay. So whose responsibility is it? You say it's an office. Who runs that office?
It falls under the training chief,
Okay.
and the quality assurance is done, not the quality assurance, the credentials are checked by the training officers.
Okay. And was anybody held accountable for this miss?
They were acknowledged for finding it and for correcting it and for bringing it to our attention immediately. So these are people that they write lesson plans, they create tests, they deliver training, they also manage credentials. Again, we expect the employees to be honest, and thankfully our training officer caught that this particular employee did not have that credential, and we took immediate action.
But is there somebody who checks? You say there's somebody now, or it's checked now before somebody gets a promotion. It wasn't then?
They always check the credentials. On this particular one, the person checked the box that they had the credential.
Right.
It was believed that they were being honest, and on a routine check of their credentials, they determined the number was not there. They did the follow-up.
Okay. All right. So are you okay with the way it all came down? I mean, the fact that they caught it afterwards as opposed to before?
Again, it's a basic premise in paramedic that we expect our employees to be honest, to be truthful with the medical director, be truthful with the department. I'm thankful that our training officers caught it. They caught it in a very short period of time. And also the employee was supervised throughout, and we've been able to apply measures that prevent it from happening ever again in the future. So I'm happy with that. I'm happy that we caught the mistake quickly and it was corrected.
Okay. So there was a mistake, and I guess the question is, who was held accountable for that mistake?
The training officer caught the mistake, and I would say the employee was held accountable. The employee is no longer working here.
Mm-hmm. Okay, but nobody in command staff was held responsible for missing the fact that this guy didn't have credentials?
The training officer caught the mistake, made the correction, and we've applied measures to prevent it from ever happening again.
Okay. All right. Why didn't Hillsborough County Fire Rescue go public with this?
We corrected the problem. I don't understand the question. We corrected the problem, an internal problem. It was an audit problem, and we fixed it. I don't tell you everything good that I do in the department. I mean, we don't report every incident that occurs every day. So, you know, again, I don't live out my life through public disclosure. Everything is available. So we took the measures that were needed. We reported it to the people that need to know it, which is the state, and we took appropriate action.
Okay.
I would say quick and decisive action.
How serious a breach do you think this was?
I think it was serious enough to the state that they removed his certificate and he's not working any longer as a medic. I think it was serious enough that the employee resigned rather than facing any discipline. I think it was serious enough that we recognized the need to have the certificate and we put in corrective measures.
Okay, all right. But not serious enough necessarily to hold anybody else accountable other than him?
We took the measures that we deemed appropriate. The employee's no longer working here. We reviewed all the calls. There was no adverse medical conditions. We did what we needed to do.
Is there a report on that? I think I've asked for it. I haven't gotten it. But was there a report? You reviewed all the calls and quality assurance, did all that?
I'll inquire, and if there is, I'll provide it to you.
Okay. Well, let me ask you this. Now, this happened on your watch, so let me get from you. I mean, do you have anything to say to the citizens of Hillsborough County to assure them that there are no other non-paramedics out there?
I already told you, we have done an inventory and an assessment of all of our medics. That was the only case that we are ever aware of happening, has not happened since.
Okay.
What I would say is the people of the Hillsborough County should know that when 911 is called, we're going to show up with competent medics that are going to deliver care.
Okay. And
He was always supervised by a rescue officer.
okay, sorry for interrupting. And you're comfortable that the care that was provided to the patients that he saw was appropriate?
Absolutely. QA bears that out.
Okay. All right. Well, those are my questions about Mr. Brosky. Is there anything that you might want to add about this situation?
No, sir, I think I've covered it.
Okay. Now, real quickly, let me ask you a couple of quick questions about EDC, because we've done some stories about that. Is there a problem in dispatch?
Is there a problem in dispatch? That's a very, very general question. There is a nationwide problem with dispatch centers. I'm not sure if you're aware, there was a Firehouse article that was published in July. Have you had a chance to read that?
No, sir.
And there was a Wall Street Journal article published in August of this year. This is very current. So there's a nationwide problem with dispatch centers, emergency dispatch centers, employing enough people to cover all the calls. So in that light, we have the same problem that every dispatch center, emergency dispatch center has throughout the United States. It's true here. What happened recently is we had a number of employees, 3 or 4, that separated employment to go into private industry, perhaps to a higher salary, apparently, certainly a different workload. They work conventional schedules, they don't have the weekends, they don't have the nights, the 12-hour shifts, and probably a less stressful environment. So I think our dispatchers do a phenomenal job. I know they do. I deal with them on a regular basis. They do a phenomenal job. They're very dedicated employees. They're in an environment where they're working very hard and long hours, and they continuously do a great job. So the challenges that we have is getting all of the positions filled. We recognize that. We have 2 that are currently being trained that should hit the streets very soon. It's not hit the streets, but hit the boards very soon, be able to work unsupervised. They're currently being trained.
Right.
We also have 5 positions that we're hiring effective October 1, and probably 5 to 7 that will be hired first quarter of 2019. So the challenges that we have in dispatch are in our ability to staff adequate numbers. The minimum staffing has remained 5 and 4. It hasn't changed since I've been here. I understand we've had an increase in calls, but we've got the same staffing that we've always had. So the big challenge is to have enough people to fill all the seats, to fill all the vacant positions that we have. This fiscal year, the one we're currently in, we were able to add 2 additional positions. I'm not sure if you're aware of that. We added 2 additional positions this year, and next year, FY19, October 1, we're adding 2 more dispatch positions. So we've added 4 over the last 2 years. Again, the challenge is to fill those. And then once you hire those people, it takes about 7 to 8 months, maybe even longer, to train those people so that they can be released on the board to handle the call. So there's a lag in training. All of that's addressed in the articles that I alluded to. It's a nationwide problem. We hire firefighters and paramedics. They come to us already trained, and we just have to orient them to our department. When we hire dispatchers, we're hiring essentially high school graduates that have to be trained from the ground up. So it takes 7.5, 8 months. It's a long process. Additionally, it's a difficult job. It's a tough job. Just like being a firefighter and being a paramedic, it's a difficult job. And so it creates a lot of fatigue, and not everyone is designed for that. So we don't retain every single one we hire. That's a challenge. Nationwide, that's a challenge that's true here. So what we've done is, for a while, we've been offering to our dispatchers voluntarily, if we're at minimum staffing, we'll add 1. Voluntarily, if they want to work overtime, we allow them to fill those positions and bring our staffing up to 5 and 6 instead of 4 and 5. Additionally, we're looking at part-time dispatchers. We have several that are currently trained, and we're training more. And we're looking at flex shifts so that we can up the staffing in that 8 to 8 period when the call volume is the greatest. We're working on that now, and that should be implemented very soon. We've been working on this. We've been studying the call volume, the peak times and all that for almost a year, and we've been trying to implement. The difficulty is in hiring and retaining the dispatchers. So, there's been a lot of talk about fatigue and stress. I'd like to address that. Since I've been here, when I came here, we had no active critical incident stress management program when I arrived. We had people that had been trained but were not active, and we had essentially 1 person trying to deal with all the problems of the department. Since 2016, we wrote a new policy. I reactivated the critical incident stress management team. We got involved with the regional team. And I've trained, I think since 2016, we've trained, I think, 12 employees, around 12 employees, one of which is a dispatcher. So they're included in that training. And now that's the first kind of level of how we recognize people that are experiencing the strains and stresses of fatigue. We also have notified our employees on multiple times of the Employee Assistance Program, EAP, that's offered by the county, as well as other departmental and fire-related programs that are available. There are many of those, and we've publicized those. We've issued flyers to the stations. We've put the word out that if you need help, you can get that help. And it's the supervisor's responsibility, really, to recognize that. I can't see it from my office, and I can't visit every station every day. It's a big county, 44 stations. It's impossible. So we rely on the supervisors to see and recognize those problems and then avail themselves of the opportunities that are provided through EAP, through other programs, and the Critical Incident Stress Management Program. And we reinvigorated our chaplaincy program. So there's a lot of things that we're doing to try to address the concerns of fatigue that are affecting our firefighters. It's a stressful job.
Sure.
I've done it for 40 years. I've been in the street. I know what it's like. So I'm sensitive to that. I'm very compassionate about trying to help our firefighters get the help they need when they need it. The union has, the International Association of Firefighters, has their own facility to deal with those kind of stressors. So, and I know that our employees are taking advantage of the avenues that are available to them through county EAP or other. So, I do believe we are concerned about the stresses of our firefighters, and we're taking care of it as best we can.
Okay. I imagine by now you've probably heard about Heather Bobo's accusations that dispatchers are overwhelmed with calls, radios, monitoring, this and that, and so overwhelmed that they, if they're sick, they end up throwing up in trash cans or buckets and sometimes can't make it to the restroom rather than leave their desks and their phones. Have you heard that?
I've heard it.
Is it true?
I have had no report of that ever happening. So when we built this building, when we came into this facility, they have their own, essentially their own suite. immediately adjacent to their workspace is a break room that's just for them, a locker room, and restrooms for males and females. It's their own facility, their own restrooms, their own break room, and they are able to go and use those facilities when needed. We're not aware of any cases where someone has had to throw up in a trash can and continue dispatching. It's, that's all I can say. They have accommodations for them. We have accommodations. They have an avenue to take care of those items, those basic physical needs, and we would not, mandate someone sit in their chair and throw up in a trash can.
Yeah, I don't imagine you would, and it tells me a couple of things.
Nor are we aware of it.
Yeah, if it were in fact true, it tells me a couple of things. It tells me, one, your dispatchers are very dedicated, that they don't want to leave their desk.
They are dedicated.
Right, and it also tells me that if it's true, that not only are they dedicated, but there might be a manpower issue here, which you, I guess,
I think I've
admit there
addressed
is,
that.
right?
Well, I think I've addressed that.
Yeah.
Our minimum staffing has not changed. We've provided opportunities for them to increase the staffing if they're willing, and we're working on flex shift staffing now with part-timers, and we are doing everything we can to hire and train them as quickly as we can. And we've upped our staffing 2 last year, 2 in the coming year.
Okay. How many openings do you have now there?
I think there's 7 or 8. Again, we're hiring. We got 2 on the floor training now, almost done. 5 more coming October 1st, and then probably 5 or 6 more. I don't know the exact number in 2019 early. Okay. So I think we have about 8 or 9 openings.
Why doesn't your EDC manager answer 911 calls?
That's a great question. Our EDC manager, if the phone's ringing and she comes into the call center, she's not sitting at the phone panels every single day. She's probably, while she has the ability to do it, her best efforts would be towards relieving the other folks on the floor of administrative details. So relieve the supervisor of some administrative work and let the supervisor answer the call, and that's what she does. And we have another supervisor right next in the next office to her who will come in and supplement the floor. Mm-hmm. So she does what she needs to do to relieve the strain on the management side and let them answer the calls.
So when you're talking about a staffing 5 and 4, and one of those is a supervisor, that's not necessarily answering calls, but doing supervisory work.
And answering calls.
Okay.
They answer calls.
Okay. All right. I think those are my questions. Anything that you think is important to get across here?
Well, I do think it's important to say how firmly I believe we have such a dedicated staff of dispatchers. Our telecommunicators, they have a very difficult job. They are very good at what they do, and we continue to try to hire and retain great employees, and we'll continue to do that. And I think they should be commended for the work that they do, and I'm very proud of them.
All right. Well said. Thank you.
Thank you.
Appreciate it.
Grab a couple shots of you guys talking, if you don't mind, sir.
So you have about 7 openings, you said?
I'm not exactly sure. It flexes,
Yeah.
and we've got new positions that won't be available till October 1. It's about 5, 7, something around there.
Mm-hmm. Now this critical, what's it called?
Critical incident stress management.
Okay. They deal with the issues of PTSD and all that stuff. I know you're talking about fatigue, and that all plays into it.
They deal with recognizing stress and what are appropriate and inappropriate responses to it, and how you deal with it. And most importantly, they are an avenue to help them find the help beyond themselves. They have immediate connection to a clinical professional. And if they feel that it's at that level, they can make that recommendation that they involve a clinical professional as part of the regional team. Mm-hmm. And get these people the help they need, recommend them to EAP, recommend them to a chaplain if that's their preference. But they know the resources, and they help them, access those resources.
Okay. And does the county offer these resources, or is that something they have to pay for themselves, or?
EAP is one of the benefits of being a county employee, a certain number of visits, basically paid by the county. And then there are other programs, fire-related programs, that they're also available.
Yeah. I know there's some facility in Maryland that deals with PTSD, I think. And a couple of your folks have gone up there to kind of, I guess.
So the International Association of Firefighters has a facility that helps deal with it, and it's available to any firefighters, any union firefighters that qualify.
Okay. Now, is that something the county takes care of? Or is that EAP, or is that on the union or the individual, or do you know how that works?
The funding of it is done by the International. That's
Yeah, the funding of the facility, but if I'm a firefighter and I'm having issues and I decide I need to go there, or somebody decides I need to go there, does the county take care of that?
Currently, the employees typically will request sick time, and I'll give them extended sick time beyond the normal amount.
Okay,
They sometimes do it with exchange of time.
okay.
And there is a state legislation that comes into effect in October
Right.
that you know, the fire service is all behind that, but there's a lot of details that have not yet been worked out.
Yeah.
You know, how it's going to be covered by work comp and what are the qualifications. There's a lot of detail.
How is that going? Yeah, that's gonna be quite involved, isn't it?
There's a lot to do between now and October 1st.
You know, we did several stories about that legislation prior to it passing, and so we're kind of sensitive to it in terms of, you know, watching to see how it's implemented. Will you guys be ready to go? Like, is it October 1st? Is that what?
I know that the county, it's basically a work comp issue, and the
Yeah.
county is looking at it very closely.